That was one of my one of the biggest problems in collecting photos for the book, is because my focus was on areas where patients spend their time, and I was stunned really to see how few examples I could find of diagnostic imaging rooms and cardiac cath labs and various types of procedure and diagnostic spaces that were other than absolutely bereft of any sort of design amenities, color. I mean, do people think that color is harmful? I don't understand it. Why there is a total lack of color, and what I think it is that it costs less in terms of expending your design fee to just have a basic color, a basic neutral color, and you just put it, you say any clinical area, boom, just make it this white color, and you put in a white or a gray tile floor and you're done with it. This is just, it just makes me crazy, because that's where patients spend their time. That's when, when a patient comes into an MRI room, first you have the noise, and you have a very frightening piece of equipment, and to have something that they see immediately when they walk in, to put them in touch with a garden, a backlit film image of nature in the ceiling or on a wall, is so important, and yet they're very, very hard to find that. I even went back to firms 3 times in some cases and said, wait, maybe you didn't really read my letter carefully, because everything you sent me was just a basic room with painted walls, a plain floor. It's not even an accent color. Here's what I'm looking for. And, they went through their files again, and, good architectural firms, when it comes to those rooms, that's what you find. Bland, bland, bland. And I think it's a shame that healthcare facilities people and healthcare leadership don't think about asking that. I often ask C-suite executives when they tell me about their new project and they tell me about the lobby and about the gardens and all of that, and I say, well, what are you doing? What are your designers doing in your imaging rooms, for example? And they look at me puzzled, because whoever thinks of asking that question? And the boards of directors don't care. They want to see a beautiful building on the outside. They want to see a beautiful lobby and nice landscaping. But they're not going to ask, well, what are the imaging rooms like? So everybody needs to be more aware of that.